On the News Channel 5 network, this is OpenLine.
Hello, happy Monday to you all. I'm Jessica Ralston. Welcome to Open Line. Tonight we have a familiar topic, hoping we get some phone calls and answer your questions, and a couple of familiar faces joining me here because we're talking about the Affordable Care Act. And once again, Jackie Shrego is here. She's a volunteer for Get Covered Tennessee. Mary Hunt is here. She is from Family and Children's Services. They have a wealth of knowledge to share with you. So if you have any questions about the Affordable Care Act, and we're sure that you're out there and you do, give us a call here at Open Line at 737+. And let's start out with some basics. No open enrollment right now. Who can enroll?
Well, there's several categories.
Okay.
So Mary and I are going to go back and forth and describe some of those.
Perfect.
The first one is if you lose your job and therefore lose your coverage through your job.
Yes.
Okay. Now, some people may have their job and so therefore they could be eligible for COBRA. But before they sign up for COBRA, we want to talk to them because there's a good chance that first of all, they will be eligible, and they might find a policy that is much cheaper than COBRA.
Okay.
Because they can get the premium tax credits depending on their income.
Okay. Now, how does one, I mean, I don't even understand how it works. If you lose your job, you don't have the coverage, you want to get online, how does that process work? You have to prove that you lost your job, right?
Well, you usually, well, first of all, if you lost your job from a company, you get a letter saying when the end of your coverage is.
Okay.
So you have a date. Okay. Okay, and you answer the questions in that manner.
Okay. Oh, we already have a call. We'll take the question and then we can go through the list too, because I know a lot of people out there who aren't enrolled are going to want to know how they can make that happen. Hi, Robert. What's your question?
Which is better, the Obamacare or Medicare?
Well, they're for different people.
Yeah.
So there is, you can't, you're not eligible for both of them.
Yeah, I mean, which is better though between the two? Like right now I got Medicare, and it's pretty expensive really on copays and everything. Is it cheaper to go with the Obamacare?
You can't get Obamacare if you're eligible for Medicare.
All right, thank you.
Well, that was easy.
not maybe the answer he wanted,
right?
But
probably not.
Yeah.
Like obviously, he was going to try to compare them.
You either are eligible for Medicare or
okay. Okay, so let's get back to it. So people will know that the open enrollment period is not available right now. So, but there are people that can still get enrolled. So we're going over those lists.
So the first one is the situation where you've lost your coverage, and that could be either you or a dependent on your policy, on your family situation has lost coverage.
Another is a change in your household. So a marriage, a divorce if it results in you losing your coverage. So if you're divorced and you lose coverage through your husband's employer.
Okay.
Having a baby could also trigger a special enrollment period, and these are either 60 days before the loss of coverage or 60 days after the loss of coverage. So if you plan ahead, you can, I mean, we can't always predict the future, but you can set it up to where hopefully you won't have a gap in your coverage.
There you go. Yes.
And when one of these events occurs, you must do it within in the 60-day period after it occurs.
Okay.
So if you lose your job today, you have 60 days from today to do this.
To make it happen. Okay. And does that cover, is that everyone? You said there were six
Oh yeah, we've got more than
right?
that. So she said childbirth, but you know, you could also adopt a child.
Okay.
Okay. Another one is a change in citizenship status.
Okay.
So if you've become a citizen or you gain lawful status. Now if you're already a lawfully here, that is, you've got documents that say you're lawfully here, you are eligible, but you're only eligible like everybody else during the open enrollment period.
Okay, gotcha. All right, we have a couple callers, so let's get to Delora. Hi, Delora. Thanks for calling in tonight. What's your question?
How do I get insurance? I don't qualify for anything, as the government officer tells me. I just wondered how to get.
Have you tried to get Medicare, excuse me, Medicaid, TennCare?
No, I don't qualify for any.
You don't qualify for that. Okay.
All right.
Dolores, one thing quickly. You have to turn down the volume on your TV or you're going to keep hearing feedback. So So turn your volume down while you're on the phone with us, okay?
Okay, there you go. Sorry.
Okay. No, it's okay. Okay, and now Mary's going to answer your question.
Without getting into too many specifics in your situation, you can call Health Assist. They're a great resource, and speak with them about your situation and what you're needing. They may not be able to help you get insurance, but they will at least be able to hopefully refer you to a medical home where you can receive some care. And that number is 615-313-9972.
That's not insurance, but you can get connected to a clinic, and in some cases you can get some assistance with medications that you may need.
Okay. Did you get that number?
No.
Okay.
313-9972.
I'll take it. I'm sorry, I'm disabled. Okay, that was
313-9972.
And it's on your screen right now, so you can, we'll leave it up there for a few seconds so you can see it, and that's the number you'd want to call for some help, okay?
Okay, thank you.
Okay, thank you. Thanks for calling in. Hi, Dennis, what's your question?
Yes, I'm unemployed, haven't been working for a while, give up, got zero income. I need to get Obamacare. Can I get Obamacare?
No, sir. In this state, because we have not expanded Medicaid, the governor and legislature at this stage have not expanded Medicaid to include people in your situation, you are not eligible to get the tax credits.
So they just tax me, take my money and pay for other people, and I can't get it?
Well, if you're in that situation, you're probably not paying taxes.
Well, I did pay all kinds of taxes.
Oh, you did, yes, yes.
And I'm sure they took all my tax money, and Obama has created this wonderful insurance that's supposed to cover everybody, all these millions of people who don't have insurance, but it sounds like we're not getting covered. Am I correct?
Well, when the law passed, the assumption was that every state was going...
Ooh, assumptions, that's scary stuff. You know what that does?
Well, you could be polite and let her answer your question, okay, Dennis? Thanks.
Sure, bye.
Bye. Hi, Philip. What's your question this evening?
My question is this, and I have health insurance through my employer, but with the recent developments with the veterans scandal, how are the American people supposed to believe in government-run health care for the entire country when they can't manage to take care of their veterans? And that's my question.
Well, this is not government-run. What you get is private insurance. So you select the private insurer that you want, and you see the doctors that are on the list that's associated with the insurance company. So it's private physicians, and you choose your own doctor.
Okay, he hung up. Some interesting calls already this evening. All right, if you have a question that's related to the topic at hand,
sure.
Please give us a call at 737+. We're not here to debate politics or anything like that. It's just here to answer your questions about the Affordable Care Act and if you can get covered and any questions you might have related to it. So, a couple more on the list of people that can enroll right now.
Right.
If you have a change in your immigration or citizenship status, and you were previously ineligible and you become eligible, then that would be a special enrollment period as well.
In some cases, if somebody thinks that they actually tried to enroll during the open enrollment and they ran into some problems and they think they didn't get good information from the marketplace, that is potentially a possibility that you could be allowed to enroll, but it will be the decision of the marketplace as to what that error was.
Okay.
Okay?
Gotcha. We have a caller. Hi there, Danny. What's your question?
Hello. I'd like for the ladies to just, let's get to the gist of this, because we have so many people that are against everybody having health care. But I want them to just discuss with your audience what the negative effects of not expanding health care has done to the state of Tennessee. I know people who are losing their jobs because the hospitals cannot fund the necessary things that they need to, because we have a governor that has not expanded health care and made our state at least give it a chance to be one of the healthiest states in the nation. Thank you very much.
Okay.
Well, there's some people in our viewing area in Kentucky where they did expand Medicaid. When the law was originally passed, it was to be 100% of all the people. And what they were going to do, because they knew some people were going to be really hard-pressed to pay any premiums, they said they would expand Medicaid and the federal government would pay 100% of that. So a lot of the states said yes. In fact, most of the states said yes. Some states said no. Tennessee is one of those that said no. Kentucky said yes. So if people don't like that, they are welcome to call the governor and their legislators and let them know. What that means is, as the gentleman pointed out, there are hospitals that are closing in Tennessee. Two have already announced that they're closing, and there are several more that are expected to close. It particularly hurts hospitals in rural areas, which means not only a loss of jobs, but it also means people travel much further to get health care. So it's a significant amount of money that the state is losing every single day. It's about $2.5 million a day that we are losing by not having the Medicaid expansion. But that is a choice that has been made, and the governor wanted to do something a little differently. We don't know where that stands at this stage. At this stage, Tennessee has not passed it.
All right, indeed it has not. All right, we're going to be taking some more phone calls here after we come back from this quick break, so give us a call if you have a question about the Affordable Care Act at 737+. We're back in just a minute.